In this video today, I'll be discussing Neuroleptic Malignant Syndrome, otherwise known as NMS. It's a rare, very life-threatening reaction to antipsychotic medication, sometimes antiemetic medication high dosage, or if we have an abrupt withdrawal from dopamine blocking medications. It is a medical emergency due to high mortality rates. It often occurs within weeks of starting any of these treatments that I've mentioned earlier. What are the causes and risk factors? So we need to know the mechanism. It is actually coming from a blocking, if we block dopamine receptors in the brain, particularly in the nigrostriatal pathway. So what are the causative medications? Primarily antipsychotic. Most of the patients that present with NMS, there's an history that shows that they've been taking an antipsychotic. Example is the haloperidol. We also see it in patients that is taking high dosage of antiemetics, and also when we abruptly withdraw anti-Parkinsonism medication, any of the carbidopa or levodopa. So what are the key symptoms? We just want to use the fever and rigidity triad, and we can also use the acronym of FAMA, F-A-M-A. The F is fever, hyperthermia. Patient present with high body temperature, very crazy temperature, more than 101. They also present with autonomic dysfunction. And what are the symptoms that you see in that? Sweating, a rapid heart rate, irregular heartbeats. Patient has a fluctuating blood pressure. Patient also present with muscle rigidity, which is the M. So, and that is in form of a severe stiffness of the muscle, a severe muscle rigidity. Most times it is described as a lead pipe rigidity. Then lastly, the altered mental status, which is seen in form of confusion, agitation, stupor, or patient might also be unresponsive. So how do we manage NMS? I've said initially there is a life-threatening reaction to dopamine blocking agents. So our aim is to focus on immediate stabilization of the patient. We also want to do a withdrawal of the triggers. And lastly, we want to do an aggressive supportive care in an intensive care unit, ICU. So let's start with our primary intervention. The first thing to do is to discontinue the offending agent. Stop all antipsychotic or any dopamine antagonists immediately as fast as possible. So if NMS was triggered by withdrawal of any dopaminergic agent, any medication that is used for Parkinsonism, our aim is to restart the medication immediately as fast as possible. Then also, we want to do an aggressive supportive care. IV fluid will be given, high hydration should be given to the patient as fast as possible, because we want to prevent acute kidney injury that is coming from rhabdomyolysis. We also want to do a rapid cooling. Use a cooling blanket, ice pack, a cooled IV fluid to target the high temperature, just to reduce the temperature. A standard antipyrexias it is not very effective in the treatment of NMS. Know that for board exam, because the fever is generated by muscle activity, and this high temperature is not coming from the brain thermostat. We also want to do continuous monitoring of the CP of the cardiorespiratory, as well as the electrolyte monitoring. Let's go again to the pharmacological management. So the drug therapy is going to be tailored towards management of the severity. So most often we start with the benzos, the benzodiazepine. That is the first line management. They are used to control agitation and also to reduce the muscle rigidity as fast as possible. Then we start with, after you give benzo, we want to give the dantrolene. It is a specific muscle relaxant. It is used in severe cases just to reduce the muscle rigidity as well as the hyperthermia. Then we also want to give dopamine agonist. This agent may be used to reverse dopamine blockage. Basically, an example is the bromocriptine. Anything that is called dopamine agonist, what it just do is to increase the level of dopamine. So we also want to do a recovery and reintroduction. So at what time does the patient recover? So symptoms most of the time recovers fully within 1 to 2 weeks. Then also, if the patient had the problem as a result of taking long-acting antipsychotic, it may take a longer time before they get a kind of resolution from the treatment. We also want to know that we need to restart the medications. That is to minimize the reoccurrence. it is recommended to wait a little bit for some time after there is a full remission from this treatment that we have initiated before we can restart the antipsychotic. Also put that into consideration. And when we are restarting any antipsychotic after the patient has been treated with all this treatment I've initiated for NMS, it is advised to start with a low dose potency agent, a low initial dose. Patient just has an NMS, and patient has gone through a full remission from all the symptoms of NMS, and you still need to restart antipsychotic. It is always better to start with also a low dose again. Let's talk about the complications. We are going to monitor for muscle breakdown because of the excessive rigidity, rhabdomyolysis, and this is then generally called extreme muscle rigidity. You also want to monitor for kidney failure. This just an highlight to what is expected to be known for the exam. For more detailed content review to pass the PMHMP, ANCC, AAMP board exam, kindly visit our website for registration at www.advancedmpcertificationreviews.com, or you can call Dr. Kemi Akinlawo at 281-372-9148. You can also send me a WhatsApp message to the same number. Thank you and God bless you all.